Some 12 million Australians facing lockdowns right around the nation. How do we get to this? How big a challenge is it at this point?
Well, we needed to get to lockdown at this point because we haven't fully respected the airborne spread, particularly of the Delta variant of the virus, and we haven't yet prepared our community with proper quarantine, with widespread vaccination, and most importantly, we haven't yet given our frontline workers in airports, as we've seen with this limo driver, right on through to our healthcare and aged care, high-level, professional level PPE, and Australia will continue to pay the price of trying to sort of cruise through the pandemic, thinking that we can get by on border closures and lockdowns when we really need to get the rest of our homework done.
We just heard a call from the Queensland Premier to either stop or dramatically reduce international arrivals. She was pointing out that a lot of the leakage is coming out from those quarantine hotels and from hospitals, as we've seen in the Queensland case today, an unvaccinated worker just working outside a COVID ward, which seems unimaginable at the point we're at. What changes need to be made ASAP to get on top of this?
Well, we need to get the government messaging correct right from the top and stop talking about opening up, which is really becoming a lie at this point. We're only about 1 billion people into a 7.8 billion person pandemic. By that I mean that only that number have some sort of immunity through either disease or effective vaccination at this stage. So new variants will continue to arise. People who are vaccinated can still transmit those to the vulnerable in our community. And we're really a long, long way from having effective rates of vaccination at this stage, or even the supplies of vaccine to get there. So we can't give up our other protections, which are to build air-gapped quarantine facilities, which are suitable for purpose, and to give anyone who's going to be exposed to COVID full high-level PPE to prevent that airborne spread. And we're still not talking about basic things like not having your vehicle air conditioning on recycling, about not sharing air with other people. None of that messaging is coming out, and we could be doing all of those relatively simple things to get fresh air into, for example, bars and restaurants and homes even, and cars, to prevent the kind of spread that's going to send us straight back to lockdown every time, because we don't have any other trick in our book at the moment.
What do you say to people sitting around the country looking at the next few weeks, thinking about the economic pain they're going to suffer? Many states are either in school holidays or about to enter school holidays next week. A lot of people are going to be suffering financially as a result of these lockdowns. What do you say to people who are thinking, well, there are only a couple of cases in each of these states, New South Wales aside, that have just called lockdowns? I'm thinking Queensland and WA. What do you think to people who are saying this is over the top, this is just a couple of cases, we need to live with this virus in the community?
Well, what we know about pandemic is that if you think you're doing too much too soon, then you've got it right. The UK and many other countries are a good demonstration that if you want prolonged, miserable lockdowns for month after month after month, then you let the disease get a hold in your community. We really must get very high levels of vaccination. We need more than 80% of the population that's over the age of 12 to have had an effective vaccine in order to protect the community from healthcare system collapse and prolonged lockdowns like we saw in Victoria last year. So I would say to them, I feel your pain. I understand this is terrible, but we do need to prevent this Delta variant from getting an endemic hold in our community, or the economic damage and the lockdown damage, including to kids' education, because we're going to have to lock down schools for a long time. This is bringing schools in, for example, Israel, who do have relatively good rates of vaccination. Their schools are having to be closed down at the moment because of school-led outbreaks just now. So we do need to take our medicine up front, and if we do the hard yards early, then it will be worth it. We can get back to a more reasonable economic situation by allowing more freedom in our community, but only if we get to zero community spread. We're not saying zero virus. We know that's impossible. We can't eradicate this virus. We do have to adapt to it being around for the long term. But if we can get to zero community spread, that'll be the best thing both for the economy and healthcare. It's got to be a win-win.
Dr. Miller, just finally, what do the indemnity changes mean for GPs? Do you expect there will be a big appetite for people under the age of 60 to go to their GPs and ask about getting the AstraZeneca?
Well, certainly I think the fear of getting COVID is much worse than the fear of getting a rare blood clot from a vaccine, and a lot of people will be doing that calculation in their mind and waiting to see which way the numbers go. I think unfortunately the brand of that vaccine has been damaged through a lot of the poor messaging that has come out around the changes to the indications for this vaccine. And people aren't silly. They look at the news overseas, they see that other countries are no longer using it and that we will not be using it beyond October. But I think that if there is a threat of disease, it's great to have a protection there for GPs. If you go through a consent process and people say, well, look, I would rather have a 1 in 30, 1 in 40,000 chance of a blood clot complication and deal with that than the certainty that COVID is a far, far worse proposition for my body, for my mind and for my future than any vaccine ever would be. So I would encourage people to get vaccinated if they're happy with that degree of risk, and many people are. Then it's a good thing that the government are backing up. What they should be doing, of course, is offering also support to people who get any damage from a vaccine. They should be offering financial support to families and to people who do have this problem, because that would also assist to move the things in the right direction, not just for this vaccine, but all vaccines.